Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article, your child, hyperactive or insulin toxic. Hyperactivity, of course, is a part of the so-called ADHD syndrome, hyperactivity attention deficit disorder, which is spreading at a frightening rate in chemicalized regions of the world. Insulin is a hormone produced by the gland pancreas located behind the stomach in the abdomen. When we eat, the blood sugar rises. The pancreas releases insulin to drive the glucose from the blood into the cells, either for being burnt out, for releasing energy, or to be stored as fat. The number one cause of excessive weight gain among our children and obesity is insulin toxicity. If your child is 10 pounds in excess of your weight, you have almost 95% probability that your child is insulin toxic. You need to do the test. If your child is more than 20 pounds in excess of optimal weight, there is a near 98% probability. This segment is a part of my series on Dr. Ali's ADHD channel. Please watch the other programs, especially one entitled Dr. Ali's ADHD Nutritional Protocol. That gives you specific guidelines that I recommend. Now, the best way, as I said, is to have a 2-hour insulin test done. The glucose comes along with it. I'm not really interested in glucose. I think glucose is very misleading. Your child ideally should have a peak insulin value of less than 20 units, usually at 1 hour, sometimes at 2-hour samples. You will not be surprised if your child is obese, it's probably going to be more than 40, 50, or possibly more. Insulin in excess is inflaming, it is fattening, it is obesitizing, it damages all cellular populations in the body. Now, as a result of that, insulin toxicity also creates problems of hypoglycemia. When the insulin is high, it drops the blood sugar very sharply, creating hypoglycemia. It also creates a sharp insulin rise, a sharp drop in glucose, also creates an adrenergic peak. And so the other program, one is entitled Your Child, Hypoglycemic or Hyperactive or Hypoglycemic. Another program entitled Your Child, Hyperactive or Hyperadrenergic. This program, Your Child, Hyperactive or Insulin Toxic. Please, please, please watch the program 7 Stages of Insulin Toxicity. That's part of this channel. The second program that I especially urge you to watch is No Diabetes for Your Child, Please. That's the title of the program. No Diabetes for Your Child, Please. ADHD is not a psychological problem. It is not a psychiatric disorder. It is most regrettable that school psychologists, psychiatrists, and pediatricians, they don't study nutrition, they do not practice nutrition, they have no clinical really understanding of the real nutritional issues. They don't go into, with rare exceptions, into the issues of gut fermentation, leaky gut state, mold allergy, food allergy, adverse food reactions, sluggishness of the stomach. I think it is a huge mistake for parents or grandparents or uncles or aunts to accept that the hyperactivity attention deficit disorder is a psychological problem and it needs talk therapy. No, it isn't. It's a metabolic issue and talk therapy is not going to work. Now, I have a series of articles posted on all the subjects covered on this YouTube channel. And those articles appear on www.kids123.org. If you have suffered, if your child has suffered intensely, low esteem because of what is happening at school, distractibility, attention deficit, mood behaviors, unexplained mood shifts, and excess gain weight that I just mentioned, you really owe it to your child to have a 2-hour insulin test. As I said, the glucose comes along with it. And I have more than 80 articles on insulin toxicities on these channels. I've written several articles posted on kids123.org, also on Wikimedical. I am a pathologist. I'm a student of molecular biology of oxygen. I've taken care of a very large number of children with ADHD, OCD, obsessive compulsive disorder, that is, autism, Asperger's. I'm presenting to you the viewpoint of my patients who are my true teachers. Whatever I present here is a gift of understanding given to me by my patients who were children. They never lied to me. They had no reason. They were not selling me anything. So I ask for your support. Forward this YouTube segment to your email, Facebook, Twitter, or LinkedIn contacts. Consider reading some of this material at kids123.org. And if you wish to support us, you can send me an email, aliacademy7@gmail.com. 7 is the number, aliacademy7@gmail. Tell us how would you would like to participate in the foundation's work. Children's Health Corps was founded by my wife Talat and I some years ago to specifically focus on issues of toxicities of food, thoughts, and stress for our children's health worldwide. Thank you for joining me. Until we meet again, may you be gracious, graceful, and generous in your spirit. Thank you.